Today we're talking about esophageal cancer, and if you have questions, you can send them to the doctors at WLBT.com. And joining us is Dr. Justin Baker with Baptist Oncology. Thank you so much for joining us today.
Thank you.
What is esophageal cancer?
Well, it's cancer that develops within the lining of the esophagus. There are really two main types. One type is called adenocarcinoma. It usually develops in the lower portion of the esophagus. Another type that commonly develops in the upper portion of the esophagus is known as squamous cell carcinoma.
Okay, do you have to smoke in order to get this kind of cancer?
No, smoking is associated with esophageal cancer, but it's not necessarily a direct cause. Not everybody that smokes gets it, but it is a risk factor.
So I was watching an episode of The Doctors. I don't know if it must have been last Friday, and they had a guy on there who chewed or dipped snuff, and he actually would swallow some of the dip. And the doctor said that that made him more susceptible to having esophageal cancer. I have never heard that before.
It is. Smokeless tobacco is associated with esophageal cancer, and again, particularly squamous cell carcinoma. Really, we see more adenocarcinomas developing nowadays, particularly with association with acid reflux and Barrett's esophagus and things like that. We don't see as many squamous cells as we used to, although we do still see them. But alcohol in combination with tobacco, whether it's smoking or smokeless tobacco, are associated with squamous cell carcinoma.
What are some of the symptoms that you would need to look out for?
Well, some people may not have any symptoms. There's no real good screening for esophageal cancer, but really the biggest symptom people have, particularly associated with adenocarcinoma or lower esophageal cancers, is reflux. Of course, some patients may have difficulty swallowing, particularly if they have some sort of occlusion of their esophagus. Some people may develop vomiting, experience vomiting, chest discomfort, even some discomfort in their throat, particularly if it's an upper type esophageal cancer. Weight loss may develop if they're unable to eat. Sometimes fatigue, because some of these patients can develop anemia or a low red blood cell count. But the big thing is, like I said, the reflux, particularly nowadays.
And that's probably perking up a lot of ears out there listening to us right now, because so many people do have acid reflux, and they've probably never known that esophageal cancer could be caused by that. So what do you do? What do you look for? I mean, when you go to your doctor, do they need to be asking, check me for esophageal cancer?
Well, I think if people are experiencing esophageal reflux, there are some simple things that they can do before, asking to have an endoscopy or something like that to check. One easy thing to do is try some antacids. One risk factor is obesity, increases abdominal pressure, which can potentially increase reflux. But an antacid, one of the proton pump inhibitors or something like that, and see if the symptoms improve. And if they do not, then I think doing an endoscopy would be the next step.
Now, I would think you couldn't remove the esophagus, so how would you treat esophageal cancer?
Well, most studies show a benefit, unless you have a really early esophageal cancer. Surgery is not the first thing that you would necessarily want to do, and most esophageal cancers, unfortunately, usually are a little more advanced. And most studies show that esophageal cancer should be treated with combined chemotherapy and radiation, and if possible, followed by surgery. But you can remove the esophagus, and some people in the surgical procedure is, they reanastomose the remaining portion of the esophagus to the stomach.
Wow.
That's amazing.
So what is the success rate when it comes to treating those with esophageal cancer?
Well, probably less than a third of patients, if you look at all comers, are potentially curable. And I know that doesn't sound good, but that's the harsh reality, because probably around 17,000 people a year are diagnosed with esophageal cancer every year. And like I said, usually the 5-year survival rate of that's anywhere around 20%, and that doesn't sound good, and that's why it's important to be in tune with what's going on if you are developing some symptoms, and talk to your doctor.
And get rid of the cigarettes and the smokeless tobacco.
And lose weight, and take your proton pump inhibitor.
All right, thank you so much. Dr. Justin Baker, and he's with Baptist Oncology. Great information. Thank you so much for being with us today. And of course, for the latest health news anytime, you can always go to our website at WLBT.com and click on Medical Matters.